breast is one of those.
So if you're talking about other female cancers, which we know the other female cancers, which is the ovary, the womb, then you talk about if you're feeling bloated, you have indigestion, you feel full all the time, your tummy is getting bigger. When you're not pregnant, your tummy is getting bigger. That needs looking into. Abnormal bleeding, like the question that was asked earlier, a menopausal lady and suddenly you start bleeding, that is cancer until it's been ruled out. Or discharge, from the vagina, any discharge that is particularly blood stained. If it's infection, you would know. If the person is sexually active and you have an sexually transmitted infection, the discharge is probably sore, it's probably itchy, it's probably smelly. But if it's blood stained, then it has to be cancer until ruled out. Yeah. What else do you talk about? We've talked about the
but it should be a regular stain or.
Yeah, so you have a discharge, you go to have a wash or you go to ease yourself and there is stain on your pants that is blood stained and you're not on your period.
Yeah.
So the question is, where is that blood coming from? And from a lady, it's a sign, it could be a sign of women reproductive organ cancer.
No. And so maybe, I think we will concentrate more on breasts and maybe have another time, so that because there are a lot of things to discuss regarding to cancer, ovarian, cervical, colon and other ones, because we don't have enough time now to focus on them. So we discuss mainly on and what women should do. Like you've said it before, that is regular checking yourself, examining yourself every month, right? Every month checking
especially
yourself.
when you're in the bath. Get a way around it, how you want to feel, just to make sure you get every bit of the breast, okay? And then under the arms as well. Some people choose to do it that way.
Okay.
Just decide to go either clockwise or anti-clockwise and make sure that you feel every part of the breast and under that arm, and the same thing on the other side. Just do it with the palm of your fingers, and if you feel any lump anywhere, I don't think it will be out of place to see if there's any discharge coming from the nipples, and if it is, then you need to seek medical advice.
Wow.
And they will take it on from there, because it can be several things.
And one can survive, right, if she has,
Well, it depends. As well as the check you can do yourself, I think from a certain age, it's also probably good to have more specific investigations for their breast. I mean, here in the Western world, we're blessed. We have mammo. From the age of 50, the NHS, the National Health, invites every woman to come and have their mammogram, which is an X-ray of the breast tissue. And the purpose is to find those early signs within the breast, where the changes is there, but it's not a lump yet that can be felt. That can be picked up on mammo. I know back in Africa then, it comes down to cost, for those that can afford it. Nobody does it. Who knows how much it costs?
Nobody does it, because everything is, you pay for it.
Yeah.
And cost determines what people take on.
Yeah. So I suppose, for the general population, for most people, it will come down to checking yourself to see whether anything feels abnormal. Those that are able to afford it, then it's probably worth to consider paying for a mammo every 3-5 years. Yeah.
I think it's 3 yearly. Up
3 yearly.
until the age of 60,
70,
5 years.
5 yearly till the age of 70 then. Yeah.
You wait for this.
Oh my goodness.
Yeah. The thing again is that there are some breast cancers that run in families actually, and but I'm sure we do not have the wherewithal to go back home. because you would have looked into the genes of that particular breast cancer, especially the one that, and if it runs on the female side, then you can start early with your regular reviews, because if you catch it up early, then hopefully it will not progress that badly before it's picked up. But we have a lot of limitations back home. That's not there. So what we're really left with is to be our own masters and start early and examine our breasts and see what happens. And just to do that regularly, and as soon as you pick up something abnormal, get it checked out.
Wow.
So your question earlier was, can the person survive? It
Oh,
comes down
there
to
is-
what stage was it diagnosed. So if it's diagnosed very, very early, where it's still limited well within the breast, and often the surgeons, if there is cancer, it's always a good idea depending on the size. So you've got to weigh it up. What is the size of this breast compared to the size of the cancer? Because once you remove the cancerous cell, you've got to make sure you've got a clear margin of normal skin around it to be confident that you've removed most of it. There might be tiny ones that you can't access them because they're that tiny, they're not visible. Also, we talked about the lymph nodes where they drain. Often the surgeons, if they're doing that cancer surgery, they would have to remove some of the lymph nodes to check whether there is sign of the spread, because it will have to spread from the breast first to the armpit before it spreads other places. So if it's very early enough and they've checked the lymph nodes are clear and it's limited to the breast, then the person stands a better chance, probably the higher percentage in the 5-year survival. So the treatment often for most people will be mastectomy, isn't it? Removing the whole of the breast tissue, plus chemo, plus or minus radiotherapy, and then having regular checkup for the other breast. Bearing in mind, if you've had cancer in one breast, then the risk is higher for the other breast. So for those people, then you need to be even more aware and have more regular checkups. Which, unfortunately, if by the time it's diagnosed, it's spread, then it's really more or less it's just palliative, isn't it? Managing maybe some chemo, some radiotherapy, but the survival rate compared to if it's limited, if it's localized to the breast, it's going to be far worse. The outcome will be far worse.
The other thing as well is that breast cancer, for whatever reason, is very aggressive in the blacks. For whatever reason.
Probably late diagnosis?
You kind of feel maybe we don't pick it up late.
Early enough,
But for us having it, our survival is not as good as for a Caucasian having it. Even with the best care, our survival is not as good. But all the same, simple, examine your breast frequently and seek help early. May help.
Seek help, yeah. That brings me to us. I had a case, very sad case. Somebody in Nigeria, an Igbo lady, probably in her 50s, they did diagnose her early with breast cancer, which is localized to the breast. Whether it spreads to the lymph nodes, nobody knows. And they said to her, the only way really forward is for you to have a mastectomy.
She was saying no.
She said no.
Yeah.
She was going from one.
I can't be for my eye.
She was going from one prayer room, healing, deliverance, to another, traveling from state to state for deliverance.
And it's spreading as you're
It's
making
spreading.
this journey.
Because you're wasting time. God is not going to send somebody from heaven and heal you. He will use people around you. He'll probably use that surgeon to give him that skill to make sure he removes all of that breast tissue that is cancerous. He will use a good oncologist to make sure that they give you the right proportion of chemo and radiotherapy to improve your chances. You can't wait for God to send manna from heaven and they will pray for you and the cancer will disappear. Unfortunately, she's dead now. Despite advice, go and have the mastectomy. go and have the surgery and still do your prayer. But she chose not to. She was going from one city, one revival, one healing to another, and it spread to the point, to the skin, ulcer, the ulcer, the blood, the pus, the pain. And you know, back home there is no such thing as palliative care.
Okay.
The pain, she died in agony, horrible death.
Oh my goodness.
In pain.
And
Her kids were watching her. There's nothing they can do. The smell, because all that pus, all that infection, we don't even have. How much antibiotics can you take?
It's horrible.
Just the dressing, it's just basically she's just using towel to soak all the blood and pus. What a life, what a way to go. But some people, unfortunately, they believe in all this supernatural miracle. I'm not saying I believe in God myself, I'm a very practicing Christian, but we also have to help ourselves. And God put the doctors there for reasons.
Exactly.
Our culture of it's not my portion. I wonder whose portion it is. It's not my portion, it's not my portion. And everything is given a spiritual tone. I mean, it's good to be religious. Most of us are.
Of course,
Believe in it, but there are things that, yes, you pray as well as receiving the care, the due care you need, considering the limitations that you have in our society. So you have to start early. So there's a saying that, I'm going to say it in the local lingo now, you've got to start looking for the black cow.
Because they say heaven helps
when
those
the
that help
sons are
themselves.
out. You just got to do that. And we should stop all this, it's not my portion, it's not my portion. It's spiritual attack, it's not my portion. Whose portion is it?
Somebody poisoned you and...
Whose portion is it? It's unfortunate. Because we don't look into family traits, we don't look into what runs in our families and stuff like that. You never know if that grandma and your mother or whoever that died, what they died from. Does it really have any bearing for you? We don't have the facilities to test in Nigeria. I think the last time I was there, I heard people were saying they go to South Africa. And then you have to eat food first. The limiting factor now is who is going to pay to take a sample that may be lost in transit to South Africa, and you're going to pay upfront. So those things limit what people do. So you never quite know what illnesses run in your family, so that you can use you being the index case to protect the others in your family. Because that's all it's all about. If somebody is identified to carry a particular gene, you look into that gene, you begin to screen family members to see if they are carrying the same gene. And if they are, that's when you start putting in preventive screening, preventive measures in place so that the problem doesn't progress. But we don't have it at this time, which is unfortunate.
Oh my goodness. And the case Dr. Choma mentioned now, the issue wasn't about money.
Oh no. Several family members offered to pay.
They don't want to lose their breast.
She just said no.
That's what happens.
She's going to receive her healing.
They don't. It's something they don't want to. We don't want to.
Isn't it better to be alive with one breast than to be dead with two?
It's sad.
It's sad, honestly.
Very.
And when we discuss this type of illnesses, it makes, oh my God, it makes me feel bad. But that's life. What can we do?
There's another one. Yeah, I heard about another one. This is alternate therapy, where they're prescribing this lady and she's paying huge amount of money. Rather than going for surgery and chemo, she's paying huge amount of money for remedies and supplements, herbal things.
Yes.
And they said to her, it heals cancer. And she believed that over going for surgery.
Now you said this, I'm going to digress a little bit.
And this lady has died.
Because the last time I came, somebody gave me this herbal whatever that prevents diabetes. That actually the pot cost 25,000 naira. I said, really? Prevents diabetes?
How?
Just pray it won't come your way because there's nothing to prevent it. It's as simple as that. Let it not come your way. More importantly, have the awareness of what the signs are. So if you're beginning to show those signs, you can begin to modify things, in particular if it is type 2. Don't go in your car from here to there. Don't eat so much. Don't drink so much. Exercise. And those are the things. Not this pot of herbal capsules that cost
there are a lot of those around nowadays.
They claim allergy,
and they claim they
also
prevent cancer, they prevent high blood pressure. And people pay that amount of money, and really it's the working class people that go and pay for those
Who
things.
has 25,000 to pay?
Nobody knows if it's not working.
Because all of those things, I don't really see the need of it. I mean, a simple multivitamin, you make sure you eat healthy, like we've been talking about. I mean, every program we say we just have to put it on playback now. Eat healthily, drink, exercise, maintain a reasonable weight. And once you do that, you don't have to dish out 25,000 naira to pay for those supplements. But yeah, it's up down to choice.
It's choice, actually.
Going back to breast cancer, what can we say is the after effect of the treatment? I think this
After effect of treatment. Apart from using the breast, chemo
you
would have the acute phase, the symptoms you will get, the side effects we call it, while you're still having chemo, which primarily it's the worst of all because chemo, it knocks out everything, your immune system included. Therefore, the doctor will have to check that the person's immune system has stabilized before they give the next dose of the chemo. So that acute phase is the effect on your immune system, which then leaves you more prone to infections. It's the tiredness, because it knocks, as well as killing the cancer cells, it knocks your own normal cells as well. So the tiredness, the aching, vomiting, feeling sick and vomiting, diarrhea, hair loss. But once you've completed chemo, then if you have to have radiotherapy, again, that's another set of side effects, similar. And the pain is more with the radiotherapy, because that is as they're zapping those radio beams, it's knocking your bone, your muscles, your ligaments. So pain is a very known common side effect of radiotherapy. But these are things with time. Once you've completed the treatment, then it depends really. Everybody will recover at a different rate. Some people will be okay, the hair will grow back, and of course the breast is gone, it's not growing back. Some people live back home that it will have to be, if they can afford it, they can go for reconstruction. But if not, you stuff in your bra. Put something inside. If you're not naked, nobody knows what's under there. You stuff your bra up and you go. And as you're recovering, what are the other side effects? I suppose the psychological effects of having gone through that process of being told that you have cancer, having the treatment, and then once it's all done, that's when the psychological effect will then hit you. And depends on how you take it. Some people might run with it and be okay, and some people might then develop depression, isn't it, and anxiety with the, wow, I could have died.
That is it, because immediately one hears,
you think it's a death sentence.
I mean, once you're told that you have the big C, there's no, you just feel this is it. This is it. And really and truly, if you think about it dispassionately, to an extent it is. You might be lucky, you come out on the other end, and people still survive cancer. So it's not as if it's a death sentence per se, but that journey is quite a tortuous journey. It's a difficult one, but people come out of it.
Yeah.
There is hope.
Yes. There is hope, especially if it's diagnosed early. There is even bigger hope. And us practitioners know your limit of competence and refer. So they get the proper treatment. At the end of the day, this is somebody's sister, somebody's wife, somebody's mom, somebody's grandmom. Do unto others as you would like them do unto you. Be truthful. If you can't be honest, there's no point leading them on and just to make money. If it's bad, it's good to tell them, but in a kind way, so that you give them realistic expectations. Yeah.
That's another thing. How to
The people
communicate.
who listen
Yeah,
to,
yeah.
because for example, the case we talked about, she was given all the options, but she chose not to.
I think we will stop here today because we have a lot of other topics on cancer. We didn't discuss ovarian, cervical, and other ones. We will talk those ones next time because we don't have enough time for that. I really appreciate our wonderful, highly intelligent, experienced. What other adjectives will I use?
It's always a
to
pleasure.
Please, we thank you so much for this knowledge. As we always say, your health first. Health is wealth. Once you are healthy, you have everything to be wealthy. There is joy in health. Doc, we need to, words of encouragement to our audience.
The thing is, information is wisdom, and taking tender steps, taking simple steps, would progress to big steps. If I should turn it down to two main things, which is a common problem back home, fibroid. Fibroid is not the cause of infertility. There are 1,001 things that can cause infertility, and the treatment of fibroid is not always surgery. Surgery is the very, very, very extremes of fibroid treatment. And fellow women, I would rather say, if you think a bit of giving yourself time, because it feels sometimes that as soon as you sign the dotted lines, the next thing is that you should be having a baby popping out 3 seconds. And understanding between the parties and a bit of patience does help. Things tend to occur more naturally than we think. And once you find yourself stressed, then it becomes an issue. You will not even get pregnant. So you just have to take things, and we are very good at praying and pray, and it will happen at its own time. I'll leave Choma to do the breast cancer.
Yeah, so like we talked about, being aware, getting to know your body, checking yourself regularly, that would help you know when something doesn't feel right. And the moment you suspect this does not feel right, I can feel something there that wasn't there before, or I can see a discharge, a leakage from the nipple, it's good, it's must go and seek help. Because the earlier, once we're talking about the big C, we have a better chance if it's diagnosed early enough.
Thank you so much. You have had them regular checkup, and this particular one we talked about breast lumps or big C, as they said. It's something that you can check yourself at least regularly every month. Just check yourself. Even sometimes your husbands or partners can help you do that. So don't be afraid. Do that, and let us always think about our health and well-being. Our health first. Ndowizi, health is wealth. Once you are healthy, you have everything to be wealthy. There is joy in health. Thank you so much, and we really appreciate it. Always watch out our YouTube channel, listen to our podcast, Joy in Health. We appreciate, and we are glad to receive your questions and words of encouragement. It keeps us up in what we are doing. Thank you so much, and have a wonderful day. Bye.